Okay, so we are talking about a skeletal system today. Like all of our system, we always gonna start with looking at some of the main functions of the system. So skeletal system, some of them is kind of self-explanatory. So for instance, you have the support of the support that's created for your body. Your skeletal system basically create the framework for your body. So all of your muscles, blood vessels, nerves, your integumentary system, everything comes on top of the skeletal system. Just kind of makes sense. You also have movement. So movement is when you guys looked at the tissue last time, the skeletal muscle tissue, we talked about the fact that these muscles are directly connected to the bone, and with the help of your bone and your tendons and your joints, you are able to basically create movement, or voluntary movement more specifically. You also have protection of the underlying organs. So for this, I usually tell students to kind of think about what is the best bony tissue that you can think of that protects your internal organs. So can you guys give me a couple of examples of those? So in terms of protection, what comes to your mind? What bone protects what structure? Anybody? Okay, so your skull protects your brain. I'm assuming that's a skull. Okay, your pelvic bone protecting your reproductive organs, correct. Your rib cage are protecting your thorax, which is basically your heart and your lungs. And then you're missing one. We're missing one, which is running in the back of your body. Anybody? Okay, vertebral column, which is protecting your spine. And again, please make sure not to confuse your, don't say a spinal cord is protected, sorry, or is protecting. The actual bony structure is the vertebral column, and what it's protecting is your spinal cord. So make sure you make that difference in terms of vocabulary. Mineral storage. A lot of you guys are already familiar with the whole concept of if you want to have a strong bones, you need to have a lot of calcium in your bones, right? Or you need to eat a lot of calcium, which people typically think about milk when you kind of think about calcium, which is, it is true. However, there are other sources of calcium in our diet that can be substituted instead of milk. But one thing that I do want you guys to note for yourself is when we're thinking about mineral storage, what we consider your bone, which is the hardest structure, is a combination of both calcium and phosphate. So remember that these two come together. And when you have calcium and phosphate together, we actually call that calcium salt. So calcium salt is a combination of calcium and phosphate, which is acting as both a reservoir for calcium, and it's also what makes your bone tissue hard. And then the last thing that we have is blood cell formation. So when you're thinking about your blood cells, we already talked about this in the terms of tissues last time, and we said that there are three different types: red blood cells, your white blood cells, and platelets. The only thing that I need to add now is how and where do I actually make these cells, these red blood cells, white blood cells, and platelets. And the location for them is an area called red bone marrow, or just simply red marrow, which is located inside your bony tissue. So if you guys have ever heard of, I don't know if you guys can answer this, but have you ever heard of people that need blood, no, I want to say blood transfusion, but that's not the right word. Oh my God. Bone marrow transplant. There you go. So where do they actually get, if somebody has blood cancer, where do they get from the donor? Where do they get the bone marrow from? Anybody knows? What's the most common place? It's actually not spine. Any other guess? It's the hip area. Hip area in an adult is the best place to get it. So that's where they put the needle. They kind of do a localized anesthetics on the buttocks, and then run a large needle up to the center of the pelvic bone to get the bone marrow for that transplant. It is painful, but again, in many cases, if successfully transferred, can save a life. So if you're not part of the bone marrow donation list, I will strongly encourage you to add your name. Typically, if you are a blood donor, they already ask you guys to be a bone marrow donor as well. So they have your name on a database. So, but if you're not, you can save a life one day. And they don't have to be your relatives. A lot of time they can find match to people that are basically strangers to you. So I encourage that. Pain for a few days, but you can save a life. Okay, so when we're looking at our skeletal system is broken down to two major classifications. And this is basically, we're looking at them in terms of where they're located. So we have what we call axial skeleton. And when you think about axial or the word axial, it basically means axis of the body. And that's what you guys see highlighted in blue color. So that includes your skull, it includes your vertebral column, the sternum or your breastbone, your ribs, and that's about it. So that's kind of form the axis of your body. Now, every bone that is coming off of these axes, coming off of this axial skeleton, is identified as appendicular skeleton. So appendicular come from the word appendix, which means extra or added on. So appendicular skeleton is basically referring to the shoulders and then your arms and then your hip bone and your legs. So kind of getting familiar with the terminology, this is a really important picture. I usually have this in your exam to kind of help you guys identify the name of the bones in general. We go into a lot more detail when we do the lab for the skeletal system, of course. So the bones that are associated with your appendicular skeleton include your scapula, which is basically a lot of people refer to it as your shoulder. The little collarbone that you have called clavicle. If you have motorcycle or riders, if you, God forbid, get into an accident, this is one of the most common bones that gets broken in a motorcycle accident. That's your clavicle. And then kind of working our way down the arm, you have your humerus. You have two bones that forms your forearm, which is radius and ulna. And to kind of help you guys remember the names, if you're holding your hand like this, so the anatomical position basically, so your palms facing outward, the two bones are parallel to each other. So ulna and radius are parallel to each other. So how do you identify them on their location? The bone that runs on the side of your thumb, that's your radius. The bone that runs on the side of your pinky, that's your ulna. So notice right here, the bones are parallel in this picture. So this one right here, what I'm running my cursor on, that's on the side of your thumb. So that's your radius. And the one that is on the farther or more medial, I guess I should say, medial to your body, that would be your ulna on the side of your pinky. The reason we're saying that you do need to keep in mind that it has to be anatomical position is because when I take my hand from this direction and turn them around, so I'm looking at the palm of, the back of my hand, these two bones cross each other. So it's kind of harder to identify. So you always want to look at them in terms of anatomical positioning of the body rather than your just looking at the skeletal system. It's not type of the bone. It's basically when you're looking at the axial and appendicular skeleton, you're looking at them based on the classification within the skeletal system. So where they're located. That's the main reason you distinguish between axial and appendicular. Okay, type of bone, we'll talk about them in more detail as we talk about them in terms of shape later on. Will that answer your question? So coming down, the bones of your wrist is referred to as carpals. So when somebody has carpal tunnel syndrome, basically, We're talking about the tendons that are connected to the wrist bone. The bones that form the palm of your hand, those are called metacarpals. And then all the bones that forms your fingers, which is in all your fingers are 3 except your thumb, those are referred to as phalanges. And this is a plural version of the word. If you're using the singular version, it's called phalanx. And again, you'll see that today when you do your skeletal system lab. Moving down toward your leg and pelvic bone. So this is your pelvic bone. That is 2 of them again, joined right at the center. If you guys remember, I mentioned pubic symphysis last time for the cartilage tissue. So that's basically right here. That's the pubic symphysis. Now, this bone you see right here, which is your pelvic bone, as a whole is referred to as os coxa. So if I just put a label on this and I say, what is this bone as a whole called? It's called os coxa. In reality, however, as we go into more detail in your lab, this bone has 3 separate bones fused together. And that's referred to as the ischium, your pubis bone, and your ilium. So there's 3 bones that fuse together to form your os coxa. Again, I don't need you guys to know that detail, but a lot of my students get confused in terms of naming later on. So I just want to kind of give you a hint here. The largest bone you have in your body is the bone you see right here, which is your femur. Really hard to break unless you have severe osteoarthritis, sorry, not osteoarthritis, osteoporosis, where your bones are basically super weak and they can crumble easily. You going down, you have your patella, which is your kneecap. And then farther down, you have the big bone that is more medial. That's your tibia. And the bone that is on the side, that's your fibula. So tibia and fibula. Now, going down to the bones of your ankle, these are called tarsals. And then the bones that forms the sole of your foot, that kind of the curvature on the bottom of your foot, that's called metatarsals. And then, of course, the same word that is used for your fingers are used for your toes, which is the word phalanges. And again, in each of your toes, with the exception of your big toe, you have 3 bones. Even your little pinky has 3 bones. A lot of people are like, oh my God, that's the small. It is a small and it is relatively easy to break. So I have people that, you know how like you walking by the side of a table or a chair and you hit your little pinky and it hurts like hell. A lot of people actually fracture the bones in their little pinky because of that force or trauma. So it is common. Is there any question, any clarification on that? Yeah, it is painful. My sister-in-law did the same thing, so it's not as uncommon. So avoid any table or chairs. Okay. So far, what we looked at is basically classifying bones based on where they're located in our body. The next way that we can classify bone is based on how they look, not based on their location, but how they look. And they're broken down to 4 categories. And the name of these are pretty self-explanatory. And as you can see them, long bone versus short bone. So when you think about a long bone, all it means is that basically this bone is longer than it is wide. So it's not a chubby bone, basically. It's an elongated bone. It does have a very pronounced shaft, which means basically the midsection is very pronounced, again, elongated. At the center of these bones, you usually have what we call a marrow cavity, and I'll talk about that in just a minute. And best example of these are basically the bones for your leg and your arms. So femur, humerus, ulnar radius. Your fingers are identified as also long bones. Your metacarpal and metatarsal, so these bones right here, and the bones of your sole of your foot. And then tibia and fibula, which forms the bottom portion of your leg. Now, opposite of the long bones are short bones. So short bones are basically, or typically I should say, they're typically roughly shaped like a cube. So they're kind of like more rounded, I guess, than they are elongated. And the best example for these bones are carpals and tarsals. Again, when I tell my students cube shape, guys, don't automatically think about this perfectly shaped structure, right? We're looking at something that resembles a cube shape rather than being elongated like the other type of bones we mentioned. Flat bones. So flat bones is a little bit more difficult to explain in terms of when you're comparing it to long bone and short bone. So flat bones typically have two characteristics. One, they are usually flat, as in they are relatively thin. By flatten, I don't mean that they are flat, as in flat surface. So the thickness of the bone is pretty thin, and they usually have a curvature to them. So look at the bones that I have provided for you as an example of the flat bone. The roofing bones of the skull. So what we have here, which we identify as your parietal bone and the frontal bone, they have that beautiful curvature of the skull. Scapula. When you guys actually look at the scapula from the side, the scapula have a curvature to it. So that's the curvature we're talking about, and it's relatively flattened or thin. Clavicle, so the bone that we have here, again, has curvature and relatively thin, which means it's easy to break. The only one that I haven't listed, and I do want you guys to know, if you guys want to make a notation for yourself, please, is there's two other type of flat bones that you need to know, or two other bones. One is your sternum. So the sternum is the bone or your breastbone. And then the other one is your ribs. So your ribs and your sternum are both identified as flat bones as well. So in an exam, for instance, guys, I can give you a list of the bones, like your multiple choice, and I said, which one of these is an example of the, or is not, or is an example of a flat bone, or example of the long bone, etc. So as far as you guys know the examples that are provided for you, including the ones that are not listed, then you should be fine. The last category based on the shape of the bone is pretty self-explanatory as well. You say irregular bone. So when you hear the word irregular, basically that means there is no specific shape to that bone. So best examples is your vertebra. You guys, again, going to get some exposure to that as you go through the lab, and you guys can see there's a lot of things sticking out. There's a hole at the center. So there's no kind of beautifully, easily identifiable shape to it. Sphenoid bone is another bone. It's actually, sphenoid bone is in your skull. It forms the area right behind your orbital cavity, and it's visible from the side as well. So what I'm putting my finger on right now, this area, this is part of the sphenoid bone. So a sphenoid bone is this literally beautiful butterfly-shaped bone that, again, no specific shape compared to the other categories. Ethmoid bone is another bone that's in your skull. It's located right here. So it starts from here, behind your nasal bone, and it goes all the way into your skull. So it would be sitting right here. That's the ethmoid bone. Again, no specific shape, bunch of holes in it. So you can't put it in any of the other categories. And there was another one I needed to mention to you guys. My brain is stopped working. Pelvic bone, sorry. I was like, what is the bone? Pelvic bone is another one that is not listed here, or your os coxa, which is also identified as an irregular bone. So these are your examples for each of the 4 classification of bone based on their structure. Any questions? Anything needs clarification, guys? I know your brain is probably fried after the exam. And that's why these lectures are recorded. So it's a good thing. Okay, so examples of the short bones are basically your carpals and tarsals. That's it. A lot of people put patella there too, but it's not something that I'll discuss with you guys, so you guys are okay. And here's basically, again, kind of bringing that whole idea together for you in terms of skeleton and providing you guys an example of each. Now, when we look at your bone, one of the first things that we looked at them in terms of microscopic anatomy, guys. So microscopic anatomy, again, we're looking at things that are really small. We are looking at the cells that are found inside your bone. And some of them, not all of the cells that basically found in your bone are listed here. Again, these are, guys, typical exam questions. So what is the job of each of these bones? Give me a name of it. What is, like if I give you a name of the bone, can you tell me the job? Or if I give you the job, can you name the bone? So this is like a kind of an important slide because it basically makes your bone function the way it is and make it a reliable structure. So what we always start with the cells that are basically originate in terms of when the fetus is developing. These cells are called osteoprogenitors, okay? So anytime you hear the word osteo or O-S-T-E, this implies bone. So osteoprogenitors are basically the most simplified version of the bone cells that can undergo mitosis and increase the number of your bone tissue. Now, when you talk about formation of the bone and destruction of the bone and maintenance of the bone, we have three categories of bone. And I'm going to give you an example first, and then we'll come back to the names of the bone. So think about your bones as a building, okay? So imagine you had nothing at the beginning. So you have construction workers come in and build a building for you, okay? Beautiful building, it's functional. When it's done, all you need to do to that new building for many years is probably just maintain that building. Just make sure everything is running as smoothly. Let's say 20 years down the road, that building eventually things become obsolete in it. It's not working, it's crumbling, right? So what is your goal? You're gonna destroy that building. So in the scenario that I'm describing for you guys, these three processes, the construction workers, the people that maintain the building, and then the people that come and destroy the building are the three categories of bone cells that I have. So when bone is originally forming, the cells that are helping you make your bone hard, adding calcium and phosphate to it, creating a process referred to as osteogenesis, which means literally forming a new bony tissue, are called osteoblasts. So these are, again, going back to that example, these are your construction workers that are going to help you make your bone. They take the calcium from your blood. Pay attention to this, guys. Osteoblasts are going to take the calcium from your bloodstream, okay? Especially if you're a child, these cells are highly active. Take that calcium and add it into your bony tissue and make your bone hard, okay? Now, does that mean that these osteoblasts are not active in an adult? That is not true. Are they as active as they are in children? The answer is no. Children are going to have a much more active osteoblast because they're starting to make bones and grow, basically. But in adults, you still have osteoblasts doing their job by taking the calcium from your bloodstream and depositing it into your bone. Now, after a while, if these osteoblasts basically get trapped inside the bone, okay, they mature up. So they grow up, basically, they say, okay, I'm settled, I'm good. All I want to do is now maintain my bone tissue. So the building is built. Now my job is to just maintain the bone. These are called osteocytes. basically bone cells. What they do is, again, it's not listed here, but I need you guys to know that osteocyte function is to basically maintain your bone. So they live inside the building and they make sure that the building or the bone is running smoothly. They contain structures like lacuna and canaliculi, etc. They're not, so kind of think about them as, you know, these people that sit in front of a monitor all day and just kind of monitor the things. They're really not doing much of a work. So they're relatively low metabolic rate. So basically they're kind of lazy. They're like, I've already done my work, I'm done. I'm just gonna sit here and watch some, you know, monitors. Eventually the bone that you have, which is about 7 years, these bones are eventually going to be starting to be old, and quote unquote. So what you want to do is you're bringing cells called osteoclasts, which are technically a specific category of bone cells coming from white blood cells. And what they do is they have this very acidic environment and they literally dissolve your bone matrix. So they undo, the osteoclasts are going to undo what your osteoblasts did. Okay? The process of these is called osteolysis. Again, osteo means bone. Lysis, if you guys remember from our last lecture, basically means destruction. So their job is to destroy bone. So I want to make a note, and I'm typing this in your chat box. So osteoblasts, guys, are highly active in children or when blood calcium is high. Osteoclasts are active when destroying old bone, which is, again, every 7 years the bones are going to be replaced, or when blood calcium is low. So a lot of my students say, well, why do I even care about osteoclasts? Like, because let's say you're a person that haven't had a healthy diet and haven't ate calcium in your diet for the past 2 weeks, okay? You've been surviving on junk food. Eventually what happens is the calcium level in your blood's gonna drop. Your body still needs that calcium. So it says, so where can I get that calcium? Where do I have a reservoir of calcium in my body? And your body says, well, I have a bunch of it in my bone, but it's solid. So how can I access it? So the way you access it, you send a message to your osteoclast. Osteoclasts go to the bone, literally add acid to the bone. And I'm not joking, this is literally happening. It add acid to the bone and, oh, sorry, I just sent it to one person. It wasn't a direct message to everybody. So it introduces acid to the bone and it causes the bone to dissolve. And after it's dissolved, it basically releases that calcium into your bloodstream. Sorry guys, I messaged one individual rather than everybody. So here is your answers. Did that answer your question earlier about what is the purpose of destroying the bone? Hopefully. So under normal condition, guys, there is a balance between osteoblast and osteoclast. So if you have if you're let's say you're a 35-year-old man or woman, if you want to maintain your bone, the activity you're seeing in osteoblast should be equal to your osteoclast. If I ask you, what about children, guys? Which of these cells will have a highest activity in children? What would you say? Osteoblasts are going to have the highest activity in children, correct? Because children are undergoing basically growth spurt, they're making new bone, they're making the new bone matrix. Now, as you reach, let's say, age of 50 and over, which of these cells are typically going to be higher in terms of activity if you're comparing them? So as you get older, which of these cells do you think is going to be more active? Osteoclasts are going to be more active. And I don't mean they're going to increase their activity. It's in relation to your osteoblast. Osteoblast is slowed down. So in terms, osteoclast activities are higher. So what do you become susceptible as you age, guys? What disease or condition do you become susceptible as you age? Anybody knows the name? Osteoporosis, correct, which basically means your bone density goes down. Good job, guys. So the main reason osteoclast, the main reason somebody becomes susceptible to osteoporosis is because in relative term, osteoclasts have a higher activity. And yes, women are more susceptible to bone loss. So the main reason, and again, we're going to talk about that later on as well. The main reason women are more susceptible to bone loss, one is the main one. What is the most important reason women are more susceptible to osteoporosis? Let's start with P. No, not diet. Assume your diet is normal. What's my condition right now, guys? Pregnancy. Children suck literally calcium out of you. So as you're actually, as the baby grows, you're basically losing a lot of calcium. So women who have multiple children, as they age, they become more susceptible to osteoporosis. And it doesn't matter how effectively you eat calcium in your diet, you are still, and it's funny because like one of my friends went to do a bone density test for free, and she's like 36, and the doctors there said, do you have kids? She said, yes, I have 2. She's like, oh yeah, so you already have osteoporosis. So like it's already starting to happen for you. It's just not going to be visible because it's in a minor case. The second reason that women are more susceptible to osteoporosis, anybody knows what that is? Around age of 50, what happens for women? Menopause. So menopause causes a significant decrease in hormones, estrogen and progesterone, which actually helps under normal condition, helps with increasing the activity of the osteoblast and maintaining the bone. So as those two hormones kind of slow down, mostly estrogen, start to lower, that causes the person to become more susceptible. So a lot of women actually undergo hormonal therapy to deal with limiting the osteoporosis, especially if they have the history. Hopefully that answers your questions. This is more physiology, but I always think it's kind of cool to introduce those concepts to you guys because it always fascinates me how, gender changes things. Okay, so osteoprogenitors, or also known as osteogenic cells, which is basically what we started earlier, becomes osteoblast. And osteoblast, as I said, if they kind of grow up and they say, I'm going to settle down, they become osteocyte. And notice the second type, which is osteoclast, have their own category. And you can see in this picture that they're literally eating away the bone. So this is this gigantic structure you can see. It's kind of like, the street sweepers. So they come in through the bone and then basically clean and break down the bone. Yes, going back to the point that they make, vitamin D, I'm not so sure about the K supplement. I know about the vitamin D3. It has to be combined with calcium to help you basically store calcium into your system. But I'm not sure about K. So that I haven't read. Okay, any other question, guys, so far? Is there any clarification or anything? So there are not 3 or 4 different type of bones. They undergo changes. So if you go back to this, the osteoprogenitors, which is the same thing as the osteogenic cells, basically become osteoblasts. So notice how the arrows is moving. And then some of the osteoblasts, if they get stuck into the bone, they mature into osteocyte. So depending on which phase we're talking about, there are these three types, right? And then the last one is osteoclast, which is actually considered a blood or a white blood cell type of cell, which is responsible for destruction. So technically, if you want to, and I put that in quote, 4 type of bones with 4 different type of jobs. But the first 3 are basically going through stages. Hopefully that answered your question, Jessica. Okay, so we looked at the bones in the body based on their shape. And we said the most common shape of the bones, or the most common type of bones we have based on shape, is the long bones, right? Basically the bones of your arm, your legs, your phalanges, etc. So when we're talking about the structure or the gross anatomy of the bone, we usually start by looking at the structure of the long bone. And again, we're looking at, pay attention to this, guys. This is gross anatomy or macroscopic anatomy, which means if I actually take a bone and create a cut through it, I can see all of the structures that I'm listing here. They're all going to be visible to us. And if we were in a classroom, then I would have been able to show you an actual human bone and, you know, a one that has a sagittal cut on it, so you can actually see what's inside the bone. But unfortunately, we're just gonna be happy with the pictures now. So let me show you the picture of the bone. And here is the bone. So here's a long bone. So the ends of your long bone, which is, you can see 2 of them, they're kind of wider. These are called epiphyses. Epiphyses. If we're talking about both of them, so the plural version of it is epiphyses, as I replace the I with an E. So epiphyses for plural, epiphyses for the singular version. You don't need to label the proximal and distal because you guys haven't learned the orientation of the bones, and it's not something that I'm concerned about. The shaft of the bone, which is the long extension at the center, is referred to as the diaphysis. So epiphyses on either end, diaphysis at the center. If you look at the diaphysis, and you can see a zoom in version of this, you have a cavity at the center of your bone. So this is the cavity. The cavity is called the medullary cavity. And as you can see, it's kind of filled with this kind of yellow material here. Now it is labeled here yellow bone marrow. Anybody knows what is yellow bone marrow actually? Any guesses? It is fat, correct. So interestingly, as you age, you will have a layer of fat literally at the center of each of your long bones. Please do note that when you're looking at a child's bone and looking at their medullary cavity and comparing it to an adult, let's say a 25 or 30-year-old, in a child, the medullary cavity is mostly filled with red bone marrow, which we already know is associated with what? Red bone marrow is responsible for production of what, guys? Anybody? Red blood cells, white blood cells, and platelets. It's just blood cells, guys. Don't separate them. Just blood cells as a category, not just the red blood cells. So in children, the medullary cavity is actually filled with red bone marrow. But as they age, as a person ages, the red bone marrow is just gonna go to the epiphyses or the ends of the bone, and then the space is gonna be filled with yellow bone marrow instead. So there is a distinction in terms of bone when you look at a child's bone versus an adult bone. So medullary cavity is filled with yellow bone marrow. Now there is a connective tissue you see right here, this lining that you see right here, that surrounds this fat or yellow bone marrow. And that's referred to as the endosteum. Break down the word for yourself. Endo means what? Anybody? Inside, and then osteum means bone, right? So endosteum basically means it's the connective tissue that's inside the bone, wrapped around your fat or your yellow bone marrow. Now, if you look at the ends of the bone, which is your epiphyses are carrying a type of bone that has a lot of holes inside of it. And that structure you can see here makes it to be called a spongy bone because of all the opening inside. Now, what is the importance of a spongy bone? A spongy bone is where you will have your red bone marrow, and you can see all of these tiny blood vessels that are sporadically passing through this. So if I ask you guys, again, typical exam question, where is the location of the red bone marrow? Your answer would be a spongy bone of the epiphysis. So I'm going to say the question one more time. Location of the red bone marrow in an adult is a spongy bone within the epiphysis. Correct. If I ask you what is the location of the yellow bone marrow, the answer would be the medullary cavity, which is located at the center of your diaphysis. So make sure you distinguish yellow bone marrow versus the red bone marrow. Now, there is everything I've been talking about so far, this is bony structure. Now, there is a break between the epiphyses and the diaphyses, or diaphyses, I should say. So there's two epiphyses and one diaphysis. So this gap you see right here, this space right here, is called the epiphyseal line. Epiphyseal line. It is actually not bone, rather it is cartilage. So make a notation for yourself. Where if I ask you, where can you find cartilage in your bone? One of the two locations would be the epiphyseal line. I'll show you this. It's nothing you guys don't have on your thing. So epiphyses and the diaphyses are separated by a layer of cartilage called the epiphyseal plate or line. And what is the importance of it? It is essential during bone growth. So epiphyseal plate or line is extremely active when a child is undergoing its growth spurt. Okay, so this is extremely important. Epiphyseal plate is not going to be active in an adult. It's just going to be basically regular cartilage that is holding two pieces of bone together. It's not actually painful. Unless you're going through a like severe growth spurts, then yes, it could be. It could cause discomfort. Yes, it has to be relatively severe. Under normal conditions, like if your child is growing on the average, it shouldn't be too bad. But if you have, extensive growth spurts, then yes, it is difficult because there's a lot of changes happening in the epiphyseal plate. So it does cause discomfort. You're correct. Okay, next thing that we have is going back to the medullary cavity. Notice that the bone that surrounds the medullary cavity is really thick and it's definitely not porous. So this is the spongy bone, lots of hole in it. But the bone on either side of your medullary cavity and your diaphysis is pretty thick and uniform, and you can see it right here as well. This type of bone is called the compact bone. So you have a spongy bone and you have compact bone. Last thing that you have is this, well, there's two things actually, sorry. Do you guys see this kind of like a layer? It's kind of glossy looking that's wrapped around the bone. It's represented as this bluish color that's run around the bone, which is right here, shown here and here. This is a connective tissue that basically surrounds the whole bony tissue. And this tissue is called periosteum. Again, the word peri means what, guys? Anybody remembers? You just took an exam on these things today, right? Peri means around, correct. So periosteum basically means it's a connective tissue that's wrapped around the bone. So you have endosteum, which is inside the bone, and periosteum that's wrapped around the bone. Last thing that we have for this gross anatomy of the long bone is looking at the surfaces of the epiphyses. So right here, you have that kind of blue color again, and then right here. So I have a question for you guys. So when you look at two bones that are coming together, so let's say your humerus coming into your ulna and radius, do you think there are bones that are directly rubbing against bone? The answer is no, right? Because if you do have that, it causes a lot of friction, right? And friction means literally you're gonna start to rub the bone off of each other. So the beautiful round edges of the epiphyses that you see in all of the bones would be rubbed off within a matter of days, not days, maybe months or years after the original creation, because there's such high level of friction. So what is the way your body protects itself? It covers itself with what we call articular cartilage or hyaline cartilage. Remember hyaline cartilage, you learn about the tissue? So articular cartilage or hyaline cartilage are basically covering the surface of the epiphyses, right? Where your joints are created. So what is the importance of having this hyaline or articular cartilage? What is it going to do for you? Anybody? Not protection, more like lubrication, correct. So lubrication is the proper word that we're looking at. So articular cartilage, this type of cartilage is very slimy and very easily slide over each other. So anytime you have two bones coming into contact with each other, then you have that articular or hyaline cartilage that allows the tissue to be sliding over each other rather than rubbing against each other. Have you guys heard of osteoarthritis? Hopefully, it unfortunately is very common. So osteoarthritis, and we'll talk about it briefly at the end of this PowerPoint, I believe, is when the cartilage that is found between either the hip bone and the femur or the knee joints or your fingers are basically being worn out. So in these individuals, the bone is basically rubbing against bone. So extremely painful. Some people associated with a bacterial infection that causes this articular cartilage to be destroyed. But typically it's actually osteoarthritis is known as the wear and tear arthritis. As in the more you use a joint, the higher chance you have of developing osteoarthritis. So it's kind of something again to keep in mind. Okay, any questions about the gross anatomy of the compact bone? Diaphysis is literally just the shaft of the bone. So the midsection of the bone, the elongated midsection, that's the diaphysis. And FYI guys, I know I kind of went over this slide, but you have the information and the names that are used right here on this slides, guys. So you have diaphysis, medullary cavity, endosteum, compact bone, periosteum, epiphysis, spongy bone, epiphyseal plates, and articular cartilage. So all the terminology that I just went over in a picture, you already have the written statements for them. So hopefully that will help you guys remember the content. Okay. The other type of bone that we have, which were the three other type of bones, right? Your irregular bone, short bone, and flat bones, the way they are structured, they're not like what we have talked about for the epiphysis and diaphysis. So they do have a still compact bone and a spongy bone. But the way they are structured is you have a spongy bone at the center, and then on either side of that, you have a compact bone. Versus you have the compact bone and the spongy bone on either ends. In terms of these three type of bone, you have kind of a sandwich of a spongy bone in the middle and then the compact bone on either ends. FYI, the spongy pattern that you see inside, which is kind of zoomed in here as well, is called diploid. So the spongy bone pattern you see inside is called diploid, which is again surrounded by the compact bone. And that's all you need to know. We're just keeping it simple. So the next thing I want to talk about is we're going to switch from macroscopic to microscopic. So basically, we're going to look at things at a smaller level. We're going to look at them in terms of histology and tissue. This should look familiar to you guys because you've already done tissue of the bone last time, which was basically the units, osteon, etc. But kind of going over the same concept. If I take my compact bone, remember compact bone was really dense bone. If I look at my compact bone under the microscope, what I would see is these circular units you see right here. So these circular units or this circular units of what is being pulled out here called osteons. So osteons are the circular units. Sorry, I'm going to move forward. Osteons are basically what we identify as functional units of your compact bone. So in this picture, again, this circle, when I'm running my cursor on, that's a osteon. Now, what are the structures within the osteon? One of the things that you have is lacuna. So remember, again, these words should not be new to you guys. These little dots that you go seeing going concentric within the osteon are called lacuna. And these are basically little housing or cavities for the cells called osteocytes. And again, if I ask you guys, what is the function of osteocytes? What is the function? One word. Start with an M. Maintaining your bone, correct, or maintenance of your bony tissue, correct. So if you're looking at lacuna are again these spotted structures you see that house your osteocytes. Lamella, which are basically everything you see in the background. So everything you see running my cursor on that space. All of those are space that you see right here. Going back to the previous picture, everything you see in this kind of yellowish colors, these are your lamella. So these are basically where you will have your calcium and phosphate deposited in. So remember what makes your bone hard were calcium salts, which is basically a combination of calcium and phosphate. So where do you store them inside your bone? You store them inside the structures called lamella. So in this picture, basically anything you see in gray color, okay, that is your lamella. Canaliculi. Canaliculi are these little tiny spider web lines that you see going kind of radiating out. These are channels that are connecting your lacuna and osteocytes to one another. So again, you don't want to have this bone cell inside the house with no way of getting nutrients. It's still a live cell, right? So you still need nutrient, it still needs oxygen, it still needs to get rid of the CO2. So how does it get all of that? And how does it communicate with the neighboring cells? And it does that through these tiny channels or canals called canaliculi. So it's the way that basically they collect nutrients and remove waste. So canaliculi is a way of communication between your cells. Your cells are inside a cavity called lacuna. Now the other question is, where do they get this oxygen and nutrients from? And for that, we look at this central opening right here. So in either pictures right here, it's this literally hollow tubing at the center of your bone called central canal. Some textbooks refer to it as a Haversian canal, which is basically the name of the person that discovered it. But we're gonna just keep it simple, call it central canal. So central canal is basically the space where you pass your lymphatic vessels, your blood, and your nerves. So your blood vessels, your nerves, and your lymphatic vessels are sent at the center of the ostium. And then again, the canaliculi are just basically take whatever is that at the central canal and send them to each of your bone cells that are around the area. Canaliculi also, the question is canaliculi function is communication. They do allow communication. So as I mentioned, if you want to communicate between one cell and another cell, that's a way to do so as well. Yes. Yes and no. So the question is, are they look like the rings of the tree of the dried xylem? Yes and no, because these are technically, I guess, how would I say? If it helps you, yes, that you can think about it that way. But instead of, it does just contain calcium and phosphate. Let's just keep it simple. I was like, I don't want to go into the structure anatomy of the flower tree, so let's ignore that. So yes, if that helps you understand it, Michelle, then yes, you're correct. As far as you understand that these rings are filled with calcium and phosphate, then you're good. Yes. Okay. So anything else? Any other questions? So in a typical exam question, guys, I can give you description of the word. So for instance, if I say, what is the structure that allows the nutrients to be transferred between the osteocytes from the central canal, what would you say? Anybody? So a structure that allows the communication between the cells and allows the cells to receive nutrients from the central canal. Which one is it? Canaliculi, correct. Thank you. So what is the functional unit of your compact bone? Functional unit of your compact bones are your osteons, these circular structures that are basically depicted here. And again, remember this for both your lecture exam and lab exam. These are typical exam questions. Okay, let's do a few more slides and then we'll stop. We'll pick up the rest of the lecture next time. So let's just do a few more slides and we're good. So chemical composition of the bone. I think a lot of you already have this understanding that my bone is hard because it does contain calcium and phosphate, right? Your calcium salt. In terms of ratios or percentage, the inorganic components, or basically calcium and phosphate, are 65% of your bone. And I'm going to ask you guys this question because for some of you that might have been actually an exam question. What is the word organic versus inorganic imply? So if you say something is organic, what are you implying? It does contain carbon and hydrogen, correct. It has nothing to do with this being natural, guys. It's the fact that it contains carbon and hydrogen. Not calcium, carbon. So carbon and hydrogen is what makes something organic. And that was the whole idea of us looking at carbohydrates, proteins, lipids, and nucleic acid, because their main components are always going to be calcium, carbon and hydrogen. So if you're looking at something that is not containing both calcium and hydrogen, we label those as inorganic. So what we talk about organic component is basically anything that contains those, which are protein fibers, anything organic like your carbohydrates, your lipids, the actual cell, which is phospholipids. All of these are identified as organic compound because they contain carbon and hydrogen. However, majority of the bone, what makes your bone hard is actually inorganic, which means they do not contain carbon and hydrogen. They contain calcium and phosphate, and that's what make, again, your bone hard and make it resistant to compression. So you cannot take your bone and compress it, even though some forces may cause it. Under normal condition, these bones are resistant to compression. Okay, so couple of things about your bone developments, and then that's the last thing that we're gonna do. So bone development happens through a process called ossification or osteogenesis. So osteogenesis or ossification literally means you're forming bone tissue. So there are two mechanisms that your body uses to form your bone. And I'm not talking about you as a person right now. We're talking about fetal development. So when you were in your mom's belly, what basically allowed your bones to be developed? And that is two mechanisms. What we identified as intramembranosus ossification and what we identify as endochondral ossification. So quick note before we move on into the details, and I think I'm going to stop here and do the details next time. Endochondral ossification, which is basically the second mechanism I listed, all of the bones in your body is going to use this mechanism, except your skull and your clavicle. So your clavicle and your skull, and not all of the bones on the skull, but we're just going to generalize it for your purpose, are going to use the first method, which is intramembranosus ossification. So intramembranosus ossification, the only bones that are going to develop through this path are going to be your skull bone and your clavicle. Every other bone in your body are going to develop through a mechanism called endochondral ossification. Can anybody break down this word? This is my last question for you guys today. Can anybody break this down for me? Endo means inside. Chondro means what? Chondro. Osteo means bone. Nope. Osteo means bone. Chondro means what? Cartilage. Again, that was an exam question for some of you guys. And what does ossification means? As I said, bone tissue formation, right? Ossification literally means bone tissue formation. So when you say endochondral ossification, it literally means what? I'm forming bone from what? Inside cartilage. Wow. Blows your mind away, right? So when you look at this word, endochondral ossification, it literally means bone formation from inside the cartilage. So most of your bones, if you think about it, most of the bones in your body actually started as cartilage and then converted to bones. I know, I think it's absolutely awesome. Sorry, I'm geeky sometimes. Anyways, so is there any question, guys? Any last minute questions before we end the lecture for today? No?